Good morning, everyone. My name is Serena Maruccia. I've been working in Monza as a deputy chief in urology for 3 years. Today, I'm going to give you a general overview of my experience in the COVID world. I'll stress the emotional impact that dealing with COVID patients has on professionals operating in the Italian healthcare system. COVID-19 infection have witnessed an upward trend over the last 4 months. From February to March, the rate of hospitalizations has rocketed. The national healthcare system has collapsed. 80% of beds in our hospitals have been converted into COVID beds. We ensure only urological emergency surgeries and most urgent oncological cases. Since February, almost every doctor has been involved in COVID patient assistance. 100 of medical internists and almost all surgeons are involved as well. The Civil Defense Department provides us daily with an overview of a national situation. Statistics are correct on the 3rd of April. As you can see, over 119 people have resulted positive, with a death rate of 12%. The bar chart shows how the age range for 70 to 80 is the most vulnerable. The reason why older people are most fragile is only partially explained by the comorbidities. Maybe other causes should be sought. In fact, Italian elderlies are not different from their European peers as far as their comorbidities are concerned. Despite this, the death rate in Italy is higher than in the rest of Europe, similar to that in Spain. COVID does not infect only elderly individuals. About 1/3 of infected people are under 50 years old, and over 9% are healthcare professionals, general practitioners in particular. As you can see, males are more affected than women, and the death rate is less than 1% under 50 years old. At the present, in the US, the number of infections doubled compared to Italy. Italy witnessed a sharper increase of COVID infections compared to China. It is worth noticing that in Italy we have recorded more than 100,000 COVID cases. In China, this number is less than 83,000, considering the fact that population in Italy is 60 million, whilst in China we count more than 1 billion people. The number of patients dying for COVID-19 is less than 15,000. Death rate for cancer in Italy in the same period is approximately 45,000. Also, the COVID-19 is not the most relevant cause of death. It is worth highlighting that people have been dying in terrible conditions. Patients lie down in a bed completely alone without the support of their families. Surgical gloves are the last thing they see and the last thing they touch them. Moreover, the beeping monitor is the last sound they hear. This dehumanization of death makes the virus such a terrible cause of death. A famous Stalin quote says, "The death of one man is a tragedy. The death of millions is a statistic." I would like to remind you that the individuals in front of us is much more than a statistic or a figure of this case study. Someone is waiting for them at home. Someone would like to be on their bedside, but they can't. When I spend my time calling the relatives to break the news about the parents or grandparents, spouse or siblings, guess what they tell me most of the times? "Please tell him that Julia is waiting for him." At the moment, I think that I don't need any medical degree, but I need a good memory because I must remember their name. Julia. Relatives are often hospitalized, and each and every one of them has a COVID-related family history. Another aspect is guilty. People might get infected because of me, and this is sad. In a such complex scenario, what would the urologist's role be? The matter is all medical professionals involved do the best they can. It goes without saying that a urologist is not as useful as a pneumologist, but we are trying to exceed what is expected from us. Since this is my first time working side by side with internist colleagues, I admit I felt like a fish out of water. I experimented an initial frustration. But frustration is not a work plan, and at the end of the day, we are surgeons. We do our best to be proactive and find a solution where the problem lies. Churchill said, "It is no use saying we are doing our best. You have got to succeed in doing what is necessary." And somewhere along the line, you find yourself thinking that your 100% is so much more than I thought I was able to do. You step up and spend your time assuring relatives on the phone because you are more used to dealing with them than anesthetics. Because taking care of someone is much more than interpretation of an acid-base balance chart. We know how to manage oncological patients and their families. We engage with nurses every day in our work. We are effective because in OR, someone is waiting for us, and we have been trained to manage time efficiently. Given this, I have been spending time reviewing the physiology of the lung and the side effect of antiviral medications, a great opportunity to improve. I would like to conclude by pointing out how blessed we are wearing our uniform. We should be grateful for two reasons. First of all, because of what we have, and secondly, because of what we don't need. A way to thank all the warriors of this world: medical doctors, nurses, biologists, volunteers, healthcare technicians, cleaning crew,